Now, I heard a new medical term yesterday, and it was one of my friends, Naga Chetty, who I worked with on BBC Breakfast for a long time, talking about her adenomyosis. What is it? I mean, it sounds horrific from the symptoms she was describing, the crippling pain that it causes her and things. Can you just tell us, when it hit all the headlines yesterday, her talking about it, what is it?
Yes, so adenomyosis is where the cells that should normally be in the inner lining of your womb, so these are the cells that each month when you have a cycle, when you're having a period, they shed and then they regrow. Instead of being on that inner lining, they're in the muscle of the womb, OK? And that's not great, because then as the hormones cycle in our body each month, that stimulates those cells, and because they're in the wrong place, it leads to a lot of discomfort, cramping, pain, sometimes even heavy bleeding. And I have lots of sympathy for women that suffer with this condition. And it's really important that we try to increase awareness of it, because many women do suffer with very painful periods and heavy periods and just assume that this is just normal. And yes, sometimes that is the case, but there will be cases where this is the underlying cause. Now, some people may know of endometriosis, which is where you get the inner lining and other parts of the body. And we did used to think that they were closely linked, but actually it's two distinct conditions. Although, yes, it's the same process of cells elsewhere, it's two distinct conditions. It's normally caused by inflammation of that lining and improper healing.
How do you know, then, if you have got that? Because, like you say, it's really hard to compare a painful period with something like that, isn't it? You don't know different people's pain thresholds, and there might be people with it who don't know. So how can you find out?
Totally. So if you do struggle with a long time, with heavy periods, painful periods, then please go see your GP or healthcare professional. Do that if you're thinking of adenomyosis or not, because there are things we can do to help those symptoms. And then the clinician will request a scan, more than likely, as well as a series of blood tests for hormonal profile to look for those cells within the muscle tissue. And what they found is when they've done investigations on samples of wombs, let's say after a hysterectomy, they found that in some cases, up to 75% of them had features of adenomyosis. So it's probably a lot more common than the 1 in 10 that you sometimes hear of women in those sort of reproductive years.
Interesting, but loads of women just put up with it, don't they? That's the thing, and they shouldn't. So there was a